Are you someone that experiences pain in your knee or at times even clicking or locking in the knee? Then you might be someone who has a tear in your meniscus. Today what we're going to talk about is what is your meniscus? How does that typically present when you do have a tear? Ways that you can manage it at home, as well as when it might be time to seek help from a medical professional. If you like this video, you can go ahead and visit our website at physical.com/Hazelton, or you could like and subscribe to this YouTube channel. Hi, my name's Megan Bourne and I'm a physical therapist here at Physical Therapy and Balance Center in Hazelton. Today what we're going to be talking about is meniscus tears. So first of all, what is the meniscus? It's a structure that actually sits in your joint that provides cushion and shock absorption. There are two different types of tears with meniscus tears. There are acute tears, where there's an actual moment of injury, and there are degenerative tears which occur with wear and tear over time with aging. So how do you know if you're somebody that might be have a meniscus tear? In the acute stage of that injury, typically this tends to occur with your athletic population who play sports that involve a lot of pivoting, twisting motions. So your basketball players, football players, golfers, and at the time of injury there'll be pain, there could be swelling, or clicking or locking in the joint. Typically that pain is experienced along the joint line of the knee. However, in the case of degenerative tears, studies have actually shown us that there are a lot of people walking around with these types of tears that don't have pain. So you might not have pain in your everyday life, but you could have clicking or you could have instability in the joint. Or there could be just certain activities that cause that pain for you. So things such as maybe bending over to pick up a load of laundry and turning and putting it on the counter. Any of those kind of picking, turning, twisting motions are going to be things that are painful if you have that type of tear. So what are some things that you can try at home to help manage your meniscus tear? So because your meniscus is a structure that provides stability, when it's torn, that creates an inherent instability in the joint. So a lot of what you need to focus on is improving the strength and the stability around the joint. And that includes not just your knee muscles, but also muscles in your hip and core as well. So I'm going to take you through a couple of those different exercises that can be beneficial to you. So the first one is a step-up exercise. So what you're doing is stepping up onto the stair, back down, and doing maybe about 2 or 3 sets of 10 with that. Studies have shown us that step-ups actually get the best glute activation out of any other exercise. Another exercise that you could try is one that will target your abductors in your hip, and this is a sidestepping exercise. How you could make this more challenging is by tying a resistance band around your legs and stepping to the side, working those muscles on the side of your hip, which are very beneficial to decreasing stress at the knee. Another exercise that you could try is targeted your quadriceps. So with this exercise, you could again wrap a TheraBand or a resistance band around your knee, and you're pushing the knee into extension, getting activation out of your quadriceps muscle. And finally, the last exercise to bring in the core and a total body exercise is a plank exercise. So this activates not just your abdominal area, but also your other muscles that are part of your core and your hips and everywhere else. So 4 good exercises to try at home, which will improve the stability around your knee. So how do you know when it might be time to seek help from a medical professional? So if you're experiencing intense pain at that 8, 9, 10 out of 10 level that's impacting every day and limiting you from what you want to be able to do, then it might be time to reach out to a medical professional, your PCP, your primary care provider, an orthopedic, or a physical therapist that can help you better manage those symptoms. So what we talked about today sounds like the type of knee pain that you experience. Go ahead and try some of those exercises that we went through. And of course, as always, if you have any questions, you can always leave comments on this video, or you can give us a call and we would be more than happy to answer those questions for you.